Okay, so thank you for attending today's webinar. Today's webinar topic is AI, especially large language model and extended reality powered mental health care. So we have two speakers. I'm Alex Lee, I'm the CEO of Tech IPM, and another speaker is Maddie Manther. She's a co-founder and CTO, Happy Leader, is an award-winning mental health platform. So I will talk about 30 minutes, and then he'll take over, and then we'll have a Q&A session. Okay, so I prepare because I'm going to go over whole the scope of the today's topic. So I prepare a lot, but I already shared my presentation in my LinkedIn. So you can check the details about the text, but don't bother about it. I'm going to go over only the essential part of that, and then you can look at it later. Okay, so the first I'm going to talk about AI, particularly large language model is a current trend in AI. So how they can be used in mental health care. So I will cover what the LLMs in mental health counseling is the most applied now. And then in diagnostic treatment and management of mental disorders, and also talk about the predictive mental health care and other applications. And I'm going to have a separate webinar for this, but I'm going to touch over quickly about how can apply the LLM-powered and LLM-generate digital twins in precision mental health care and predictive care with the LLM-powered patient digital twins. And then I'll talk about my specialties, the data therapeutics. And then I'm going to talk about in the XR, extended reality. So extended reality means virtual reality, augmented reality, and mixed reality. So XR-powered mental health care use cases. So it's a real life use cases. I'm going to show some part of that I have. And the future of the XR-powered mental health care. So I'm going to talk about a little bit like exciting and some interesting project. It's not yet in commercial, but I found it is very promising. And XR Powered is a therapeutics also my specialty, so I'm going to talk about it. And briefly touch over future of AI and XR powered mental health care. So recently there were a lot of the initiated by the Apple provision. So we are in a special computing area before it boom by the Mark Zuckerberg by the metaverse. I work on that metaverse for 2 years heavily intensively, but now is a trend shifted. The compare with the metaverse and the special computing is that they are very similar, but the metaverse that focus on more and more virtual space, especially computing more and more combination of real space. So you can think about it's a virtual reality, augmented reality side of the which one is weighted more. And then they can be combined with AR-G3 for mental health care. So this is will be in trend. And then this is a completely new thing that I have is a non-player characteristics. There is a new game entity. And then in the virtual space, you have interactive games, 3D game, and then you have some kind of the characters actually nothing to do with your gameplay. So they are purely generated by the AI, and particularly generate AI like a large language model. And then they can be very promising like application in mental health care. So I'm going to briefly talk about because this kind of application you will not hear anywhere because this is first time that I'm talking about it. And then I'm going to show some of what I have done. So I'll give you some information about the mental health space landscape and product innovation procedure and something like that useful to you. Okay, so I will start my first topic. So AI and then LLM-powered mental health care. Okay, so counseling is a well known before the chatbot, so it's a healthcare chatbot. So usually chatbot means that they are therapists, like they are engaged with a patient, and then they are conversational agent, and then through the conversation and they talk about the symptoms, what the status, something like that. Through the conversation, they got the idea about what the current patient status and what kind of like best way to treatment or something like this. It's something like the man is like a human like a therapist to do counseling to the mental health care problem with the patient. The same thing, but in the replaced by this large language powered chatbot. So they, like the LMR is a generated AI, so they have a creative, and they understand the human language. So they try to understand what the patients talk about it, and then they support, like, for example, not critical things, but maybe the non-judgmental support. So they can support the clinicians that actually the interface with the patient and all the information that require the patient to provide automatically, and then also educate patient and get the information from the patient so that actually the therapist can have from the information gathered by the counseling. So I think that this is the most promising area, but still, for example, they are not fully understand empathetic understanding because they are not because there are many technical ways to actually try to understand emotion, like empathetic one, but still we are not there. So we are not completely understanding the complex nature of the human empathetics. So sometimes they require like a reinforced time learning. So if you are expertise in AI and about the reinforced learning, they try to do like a learn your AI through the like some practice and reward practice real something like that. So it is a human interruption we need now, and then they will need a guide and then some kind of like guideline they should provide, so still have a not completely automatic through the AI. And then most truly the still large language model has some, and their performance is not there yet for the critical application. So there are some errors, and then there is like some misleading like information you can have, is just use the very careful. So we until like if you really apply this in the real life, to the you need to have some rigorous testing and ethical consideration you should consider. And the next one is the it'll be changing over time, that what we have done for the patient in the diagnostic treatment and management of mental disorders. So this is the targeting all this screening information. So you may know about what is different between the screening and diagnostic, right? Because the screening is you don't have any symptom yet, right? So you don't have any like a symptom of the whether you are the mental something have a mental problem or not. But through the screening, actually, you can find out some way to have a you to be reappear symptoms while you're already in the like some problem, but you didn't recognize it. So all this screening, you have a screening, and then you can have a like a better way to treat or prepare or prevent. So this is very important, and then a large language model can have this kind of capability, because they can understand the detail about the data, and then usually we call like the digital phenotyping, and then they utilizing some digital biomarkers to find out whether there is some kind of the unnoticed like some signature that you can find out whether there is a symptom of the mental or not. And then also like they can throw this kind of detail like some prediction or the screening, so they can provide by better way the information you can have it in the management of your mental cycle. This is the same thing. So you should be ensuring accuracy and reliability of your LMS. So what I'm talking about now is rather than less than commercial level yet, but still actively like researching and then developing. And then there are many startups and then the incumbent and then research university. They all focus on this kind of the activities. So it'll be soon, because it'll be done like in parallel with like in the technical side. Large language models still need a lot of the improvement required, and then the tested and applied. So it'll be take some time, but still it's a very exciting topic that we can endeavor. Okay, and then practical mental health care is is a way to actually that you provide all kind of like your real-time data, and then with the combination with your historical data in sort of like EHR, and then they can predict something in what happened in the past through your previous one based on that, and then they can predict what happened in the future. So this is one way create also active in research area now. So this is one thing that I tried in MIT, and then they tried because here is LLM. I'm talking about just one, but this is you have a dozen element available you can apply in publicly available. Even like a privately, you can have a charge, but you can have a lot of the elements available. And then particularly recently, that there are more focus on train for the healthcare innovation, and also like you can train for yourself. So you can training your own way to do like make more smarter these elements. So this is will be the next part in the future. And then also the other area you can think about is treatment planning and medication guidance and the patient management and psychological education that you can have it. Okay, so I provide some reference, you can have it. And then I'm particularly interested in digital twins because particularly I've been in technology area for 30 years. And then digital twin concept actually is came up quite a long time ago, but it was applied several times in even many times in healthcare area, but mostly for the physical digital twins means that they like a digital replica of your heart, your organ, your body, or something like that. So physical entity things. But recently there was trial. They try to like simulate. They try to represent your mental state. So I've seen several efforts to that. So they want like you to just a twin of your mental state. And then one of the beauty of this one is that you have a mental space like a this twin, and then you can apply whatever therapy you want to do because it's a risk free, right? So you can try that and then reiterate it and then improve on it and then retest it. So this is a very fascinating the topic that I'm thinking about. Particularly, they can be like a criticism because it's based on your like a personal data and the personal reaction they can apply to you and adjust treatment based on your personal needs or something like that. So this is maybe prison mental health that available, and then it'll be very promising area that we can try. Okay, so I'm not going to talk about much because I'm going to have a separate webinar for this. So if you're interested, and then I have information in back, so you can get it later. And this is one thing through this is actually tried that in UK and the UK hospital, they collaborate the several hospitals, the EHR data, and then they look at the time history of the previous older like a patient and they categorize the population level or the individual level, and then they make like a time history of the whole the patient, so based on this time history they want to like a predict a time trajectory beyond that actually they have information. So usually this kind of type is that they only simulate about your time history. So usually in the technical sense they call digital thread. So the difference between the digital thread and digital twin, complete digital twin, is that whether you have a feedback loop. So once you have a time history, but in a certain point you have a bag, and then you have a like some feedback and then reiterate and then go back again, and then so it kind of like dynamic adjustment is if you can do is a digital to improve this. But you have like just one side, and then the only can predict one side with like the beyond the certain point of in the future they call this a threat. So usually up to now I've never seen actually that there are full like a dynamic readjustment like a full-time like adjustment of this kind of operation, these are twin for the palliative care yet, but it'll be happening in the future. I'm also very interested to do that. This is one prior. Okay, so design therapeutics. This one my motivation is that actually I want to look at this in the deeper level. So I start with all the like stakeholders' patents. So I'm a patent attorney. So I look at the what the patent actually can cover this fascinating area. So I intensively search and review the older like the relevant patents related to therapeutics. And then I found that most of the like a majority that innovation will happen in the mental health space. So I found there's a lot of innovation is going on in DTX. So I never heard about yet any kind of like a very like what do you mean like for example like a blockbuster like a famous type drug already in DTX in the mental health. But I found that there are, for example, recently I analyzed what is the startup in the mental health. I found that around 60 in the mental health DTX startups. And then there are many different stages, and there are some company actually already produce some product, and then they under like a FDA clearance, already have them clearance or something like that, but still we are not fully like adopted or the level that actually there can be fascinated to like payers to get the reimbursement something like that, but still is ongoing on. So so usually I found that they have a very similar pathway, even the innovation. So what I've seen in the mental health care is the first thing that I give you the so based on this one actually that I wrote like some how to innovate your digital therapeutics in mental health. So I provided some guideline, and then I posted in my LinkedIn. So you have the link that I provided in my presentation, but you can look at it as the first for the like the analyze the data. Usually they analyze the speech, text, and facial expressions to find out the disease biomarkers. So the this based on starting from the data is related to patient. Okay, so whether it's EHR data, real-time data, all kind of like a data related to biological or the physical or the other like emotional data, using that and then try to diagnose the mental state correctly. And after that, actually, they try to find out the correct like therapeutic trend. So what they're doing is to what kind of like what first they look at it based on the patient's symptoms and the current state. What will the best way to deliver their therapeutic mechanism? So therapeutic mechanism means that actually it can be delivered by the stimulation or by the conversational agent. It's a delivering therapeutic method. And then therapeutic method itself is well known in the mental health. For example, they are one of the like a CBT or the like mindfulness. You can think about all kind of like a therapy. You can choose it, and then planning based on the data analysis, the diagnostics, and then provide to apply to the patient. And then after that, actually the one time of iteration, they get the like a feedback, and then reiterate. And then at this time, actually, the AI analyze the data and then to get the like most important factors to how to actually evaluate their first trial, and then try to find out the early like a detection and the early intervention, something like that. And then after that, actually, they doing done by the AI, but the real time was just so the treatment ensure the intervention align with the patient current need, and then try to get the outcome. So they will apply this adjustment and then apply this therapeutic means to the patient, and then find out what the outcomes coming out, and then measure the efficacy or something like this. So procedure was very similar. And then the difference was the how to actually approach the like for example, depending on the PTSD or the depression, anxiety, or the other type of the mental health problem. Actually, they approach it in different way to deliver, but I found a very similar procedure. Or and then so this is one I think about. Recently, there are a lot of the game like a guided meditation and behavior activation task or something like that they can apply. Okay. So here I say the problem solving therapies and behavior activation and mindfulness is one of the examples that you can think about it. So I will scale over because you can read it. Okay, so XR powered mental health care. This one I just showed some real life example is XR Therapeutics in UK. What they're doing is using this, usually they call the therapeutic mechanism they're doing is virtual reality. And then therapy is exposure therapy. So that actually, for example, PTSD or the phobia, and then for example, they have a like very different scenarios and develop this based on scenario, this kind of virtual experience. So fear of flying, and then they expose you in the flying situation and a little bit more like to apply to you, and you have like a get over whatever you have some problem. It's a very similar because this is exposure therapy. So like immersive experience, you will experience as if you're in real life, but it's a very risk-free, right? And then it can be applied in the adjusted by based on your your condition or other things that you consider based on your fully personalized way to that. Okay, so this is another one that you can also like including mindfulness intervention like relaxation, meditation. So you can provide all kind of different way to actually the in the immersive experience. This is one example actually. This graph is I generate using ChatGPT, but this is where actually you can provide the digital content in you can apply in the virtual reality and also like you can apply augmented reality or mixed reality, whatever you want to targeting. And this is another one. So realized care is they have a different type of like a CBT and the mindfulness, and then they provide. So here is the important thing is a content development because it's a therapeutic content development. It's not usual like the visual content you can have in a game or the like a metaverse and something like that. It is all these contents have a therapeutic the content. So it should be collaborate with the therapy expert to what kind of therapy the content actually can be effective for the some kind of like symptoms of the current situation of the patient. So this is a fascinating topic that I'm interested in. This is another one actually. This company tried to have like a this vessel is a well-being vessel. Actually, they provide all kind of like a sensory information, not only the posture, really type like a visual, they touch everything that you can have it. So they provide mixed reality type. And then they try to provide all kind of the therapeutic content to targeting like relax, visceral, mediate, transform to give you some like relaxation, emotional, like a safe, all kind of like that I had mentioned before. They can apply in so this kind the best maybe in the maybe in the clinic or maybe home care. Like it's not it's still in the uh, just proof concept proof. Right? I think that I'm not saying that they have a MVP or not because this is just from their patent. But anyways, a little bit of fascinating topic, something that recently there are a lot of interesting in applying Excel in home healthcare. So remote healthcare is one of the topic. I know the FD have a center for that. I think that this kind of topic will be very interesting to apply. And then another thing that with the digital therapeutics also have a very interesting topic. So here is a very similar that I talk about AI. So here is the most important thing is how you develop your therapeutic environment, like a 3D or whatever the immersive environment, and then therapeutic content actually that can directly interact with the patient to provide some therapy mechanism. And then also they are very important is to how we actually dynamically adjust. So I'm going to talk about later in that how actually the AI can integrate with XR to provide this one like a dynamically changing content based on the current state of the patient. It will be a very interesting topic that we can explore in the future. Okay, so I'm going to skim over because I only have a 5 minutes. Okay, so let's touch about the what will happen in the future. So one thing, this is one I'm thinking about because I'm the innovation consultant, and then I'm having in mind based on my honors. I think that at least for the digital therapeutics area and utilizing XR and then the AI particular large language, I have a full understanding. So I just try to find out what should be left over, what kind of should be more further improved, and what kind of thing will be fascinating to be explored more. And here is a two case actually that I just select, but I have a more But here is one thing that they will all combine into it. So that I mentioned about is the creative extra content generation with the generator, with a very interesting topic. So I'm very interesting is that like based on knowledge base, like for example, like the combination of the the designer, the 3D designer, there are out there the 3D designer, plus therapeutic like professional, and then combine them and then train the element based on their knowledge, and then they have like equivalent that kind of knowledge, may they can generate the whatever you provide, like if your prompt engineering provide some kind of like I want to do, for example, I want to do like have a like this content to provide the relaxation. So to try to do maybe relax in the like landscape, whatever, that you provide some guideline and they will create different type of all kind of optional of the 3D environment with the digital therapy content. Very fascinating. I'm not sure whether when it will happen, but it will require a lot of computing power. But anyway, it will happen. Another thing that is to like digital twin because it'll happen. The AI digital twin will be combined. So your digital twin is smart. So it will be like not just passively like getting your data and then simulate it and then readjust it. It's not just for actually it'll be like ever evolving using the AI. So digital will be smart. So it'll be like more depending on your like a practice or the test or whatever. It'll be more evolving, and then it will provide a more better way to actually the to provide. For example, you wanna like test your new drugs, and then you wanna target a specific population or specific the target individual patient you want to targeting, and then you provide that on, then you provide the best way option to actually provide the answer and then provide the guideline how to improve the drug. Some kind of scenarios, And then I hope that the efforts like the special computing, because it still is very expensive, because it's too much like to pay like a $300-$500, right? Is still money, but it happened that in sometimes it like the common price a lot of people adopt, and then the price decrease, and then it'll be the like a user tool that you can relax is in home, and then you can have had as some therapeutic effect like using this XR device in the future. Okay, final thing. So NPC, I'm very interesting in that because this idea actually got on my LinkedIn connection, and actually there's I have a look at her thesis, and on her thesis, it talk about a little bit about it, but I have a discussion with her one time. She's in Malaysia now, so he is a very midnight, and then I asked about, do you have any idea that you just vaguely talk about there may be possibility NPCs maybe in mental health or whatever in the healthcare DTX, and then she said, oh, I never think, but I just person. So I got attention this one. So I tried to find out. I'm gonna talk with recently I talked with some expert in game. Do you know about the NPC? Everybody know about the NPC in the game because this is still hot topic. And so I try to find it because they are very characteristic, like for example, that the mental health care problem because it's kind of like they have something that the group session that is a very important, right? And then they can be like provide some group session that at the time I just have some vague idea of how to apply this one. And then I found the dig into that and oh, it's fantastic because they generate AI, and then the game environment is still is you can therapeutic effect in the mental health care. So the mental health treatment is a part of the your treatment game, and then you involve, and then there is NPCs join, and then they will link with you, and then they will communicate with you. That I mentioned uh, a large language power, like the therapeutic, like counseling, something like that. So they can be your counselor, or they can be your peers, and then they will interact with you, but unbiased because they are nothing to do with you. They are just generated by the AI, unbiased by you. So they can be a very, very, very objective. So I found, oh, it's very good topic that should be further explored. So here is just a little bit that I just came out some this kind of idea maybe apply, but I need to more dig into. But maybe if you're interested, then maybe we collaborate for this. Okay, so finally, and so this is one my recent work about. I actually I accumulate about the 200 startup, and then I reserve it about I found out about the 180 actually, and up to now have a startup, and then I provided some landscape for the mental health area. I provide the whole thing, but you can see that there are many still in the ongoing in the mental health care space. And this is one actually that based on my pattern analysis, I found a very similar pattern in the pattern in the like innovation process. So I provided some guideline how to do if you want to start from the scratch. And then if you want to do something, then I provide some information based on my analysis. So you can look at it later. Okay, so this is one this is my upcoming webinar on June 19th. So we are going to talk about more deeper level of the XR and AI powered digital twin in healthcare. So if you're interested, you can join this one. Okay, so I'll pass over to Maddie. Let me. Okay, are you ready, Maddie?
Yeah, let's do it.
You can briefly introduce yourself again, then you can start. Yeah.
Okay, sounds good. Share my screen. That looks good.
Yeah, perfect.
All right, sweet. That was great. And Alex, I was wondering, we should probably add Happy Pillar to the that landscape chart that you showed. Cool. Okay. Hey, everyone. Thanks for having me. I'm Maddie Mantha. I'm the co-founder and CTO of Happy Pillar, and we're innovating pediatric mental health care delivery. So today we'll talk a little bit about what Happy Pillar is, how the therapeutic mechanism works, the science and technology behind our platform. We'll also deep dive into the machine learning models and the tech stack, and take some questions at the end. Cool. So as you know, children's mental health is an urgent need. 1 in 5 kids is battling a mental or behavioral disorder, but only 20% of these kids have access to care. The demand for mental health services is skyrocketing, with parents begging pediatricians, schools, and hospitals for help, and waitlists being at an all-time high. So our solution is Happy Pillar, an innovative program that provides mental health care to children via the most important people in their lives, their parents and caregivers. Happy Pillar's mobile app is available 24/7, and it only takes 5 minutes a day to use. We use AI to deliver evidence-based behavioral health treatment that's designed by licensed clinical therapists in a personalized, self-guided format. So at its core, Happy Pillar is a fusion of clinical expertise and artificial intelligence. And this combination makes us infinitely scalable. Our short instruction videos are as easy to watch as a TikTok. We have content from clinicians and experts. So Happy Pillar's treatment involves daily therapeutic sessions that only take 5 minutes. And these sessions can be done anywhere at any time. Happy Pillar guides these sessions, instructing parents on non-directive play and communication techniques that have been proven to affect a child's mood, anxiety, and behavior. And while these sessions are happening, Happy Pillar listens and analyzes, and we'll get into exactly how we do that in a little bit. So it listens and analyzes and then provides personalized real-time feedback. During these sessions, as we're listening and providing feedback, parents are able to access all of this data. And doing these sessions regularly is what makes this type of therapy effective. So we've gamified the process by motivating families with scores, badges, and streaks. Parents complete regular assessments to highlight their child's progress, to encourage consistency, because this change is often hard to see on your own, and looking at progress data reminds you that this entire process works. We did an impact study, and in our impact study, 98% of parents see an improvement in their child's mood or behavior, and that's just within 3 weeks of using Happy Pillar. So let's talk a little bit about the science and methodology behind it. The therapeutic strategies are taught by Happy Pillar. These These strategies are recommended by many pediatricians, and they're backed by decades of research showing that this type of dyadic parent-child therapy is effective for depression, anxiety, disruptive behavior, and even trauma in patients aged 2 to 7. In PCIT, therapists go beyond presenting new skills to parents. They make sure that parents are correctly applying these skills, and they provide feedback. And their feedback is based on the dyadic parent-child interaction coding system, or DPICS. And Happy Pillar uses AI in the same way. We analyze language to ensure that parents are effectively helping their kids. Our clinical director, who's actually on the call, I think, Chloe, is certified in PCIT. She consistently refines our NLP pipeline to align with the DPICS. And we also use machine learning, specifically collaborative filtering and content-based filtering recommendation engines for personalizations. We know that individualized care is key to improving outcomes. So parents receive specific recommendations for content, for activities, lessons, and so on. And these personalized recommendations are built on, multiple factors, including the child's age, goal progress, weekly check-in responses, and so forth. This is a really exciting time because AI and NLP have created an entire category of companies that wouldn't have existed before. And because of our proprietary AI platform and unique data annotation techniques, we're able to replicate the therapy mechanism to provide identical benefits at a scale that didn't and couldn't have existed before. Our clinical director trains the parents on the skills of a therapist in an app, and instead of a therapist in real time listening to you once a week, the app records your interactions every time you use it, and it provides feedback on how you did and how you can improve. And instead of data engineers, annotating this conversation data, which is typically, what we've done, it's the clinical team that annotates the data, ensuring that the models are as accurate as in-person therapy sessions. And right now, our models match therapist accuracy. We've built all of the technology ourselves. I've been working in machine learning and AI for over a decade, and we have the largest parent-child database and language model. All of this is proprietary. It supersedes human accuracy, and it is patent ready. So I'll walk you through the back end and how it works. The primary user interface is the mobile application. It's available in iOS and Play stores. Parents can download it and start using the app almost immediately, and the kids don't interact with the app at all. The inference engine, which is the back end, has multiple modules. The first module is, or component is speech to text. We translate the speech into text. We diarize or identify the parent versus child speakers so we can analyze the parent speech, and we only analyze the parent speech. All of this is scrubbed and anonymized after the recording. Right now, we're working on our own diarization engine, which we're launching in just a few weeks. It's built from scratch using our own data and over 2 years of research. And it specifically focuses on parent-child, interfamilial parent-child diarization, which is a huge challenge in the STT arena, and Alex would know why. It's because, typically it's hard to diarize children. There isn't a whole lot of child conversation data, and that's what we've been collecting for over 2 years. The next component is the sentence classifier, and for that we use a combination of homegrown intent identification and entity extraction models that are built on top of our proprietary LLMs. The models have been iterated on over 25,000 minutes of data since launching 2 years ago, and we've improved upon our models. We've increased the speed and accuracy, and we've been incorporating production data pretty frequently. For one of the skills specifically, parents are taught several skills within Happy Pillar, but for one of them, echo, which is where parents reflect back the child's speech, we use sentence similarity, specifically semantic textual similarity techniques. That's where we vectorize the sentences, the words, and then we calculate the mathematical distance between them to see how similar they are, and that's how we're able to calculate echo. So then the inference engine generates what we call a happy score. And the score is a composite metric that's designed to quantify, the quality of interactions between the parent and child. We evaluate both positive reinforcement behaviors and negative directive behaviors. And we use a multi-component formula for this. So the score combines weighted contributions from several categories of conversational elements, and they're scaled to provide a balanced assessment of the interaction quality. We want to incentivize longer interactions, at least 5 minutes. So a fixed bonus is awarded if the conversation duration meets a minimum threshold of 4.5. And each of these positive behaviors is initially given a base score. And any additional instances beyond a certain number are rewarded with extra points to further encourage these behaviors. And each of the negative behaviors is penalized. And the penalties are small for a few instances, but become larger or more progressive as the number of negative behaviors increases. And to keep the score within a practical range, the total score is then normalized. That means that it's adjusted to fall within a certain range. And that makes it easier for us to interpret. It makes it easier for us to compare across different conversations. And parents have access to all of this after each session. They get access to detailed and personalized feedback and historical data as well, so that they can see their improvements over time. I know security is a big thing with mental health apps, and we want it to be, and we are super intentional about security at Happy Pillar from the get-go. We learned that many mental health apps aren't necessarily regulated. There aren't rules around this, but we still wanted to treat recordings like private medical records. So we scrub PII and we anonymize the data. The data is then stored on our HIPAA compliant servers. TLS HTTPS is used when communicating between the backend and the front end. So that's essentially encryption in motion. Parts of the data are encrypted after we store it in the database. So that's how we encrypt data at rest. We also follow SOC 2 compliance standards and HIPAA compliance in general. And one thing we're pretty proud of is ORCA. It's an independent digital health assessment tool that's very thorough in its review of a product or a service's safety. And we passed ORCA's digital assessment review quickly within launching the app over 2 years ago. We're also thinking about on-device inference at the moment. And for those of you familiar with it, on-device inference really is the gold standard in security, right? But one thing we're considering here is thinking about the trade-off between providing the best collaborative filtering mechanism and recommendations to parents, which, as you know, collaborative filtering and content filtering trains on all of the conversation data. So we're thinking about the trade-off between that and on-device inference considerations, where we're only recording on the device and we're only training off of that one family's data. But as models get leaner and faster, we'll continue to evaluate and provide the best user experience. Other things to consider are latency that can happen with on-device inference, but nothing that GPUs and leaner models can't solve. Cool. So we've proven ourselves over the past 2 years since founding. That reminds me, our CMO will want me to remind you, we're throwing a 2-year anniversary celebration for our investors and folks in the digital health space in 2 weeks in New York City. So if any of you are in New York or have friends that are passionate about mental health and looking to grow their portfolio, let me know, and we'd love to see you at the event. But our reviews have been phenomenal. Our growth in revenue and users, has been pretty undeniable these past 2 years. We've received these awards and acknowledgments, including winning the 2023 Pediatric Innovation Competition with Matter Health Accelerator and Parkview Health, which is an 8-system hospital system. While our consumer traction is strong and it's growing, over 100% month over month, there's both a need and opportunity to position this in schools and healthcare systems. And we're well positioned to get there, thanks to our team. Cool. Alex, thanks for inviting me. This was fun. And if there's time for questions, would love to open this up.
Oh, fantastic. Thank you. So anyway, if you have a celebration in New York, if you can visit Boston, we have about 4 hours from New York to Boston. So I will welcome you. And then I
Awesome,
can to introduce your fantastic work to my the mental health community in Boston area. So let's think about it.
Yeah, absolutely. That sounds great. We'll be in Boston in October for the Digital
Oh,
Health
really?
Innovation
Oh,
Summit. But yeah, I'm
okay.
sure.
Could you out from the slide mode so I can look at the question in chat?
Yeah.
Okay. Okay, perfect. Okay, so let me see. Is there any? If you want, you can raise your hand and you can have a question. You can talk about it. I'm not just looking at the.
Thanks, Julie, for putting the invite in the chat. Yes, I see a question. Do you know if any models that take the place of a clinician have been tested again, nationally accredited board tests, like for licensed clinical social work or licensed mental health counseling or psychologist? That's a great question. And, since Chloe's on the call, if she doesn't mind, I'd love to call on her to see if she'll take that one. I mean, she can answer it better than me or anyone else. She's our clinical director. But I will tell you a little bit about just how our models work. So first of all, Alana, this is a great question. When we started, there wasn't any publicly available accredited data sets that look at parent-child conversation data. I mean, I guess that's good because that's not out there. So we had to collect our own seed data and start from scratch. And the way that we annotate the data after we anonymize the data, so that way it's not like, Maddie and I do Happy Pillar with my nephew Fulgun. That way we're not able to see Maddie and Fulgun said this, rather parent and caregiver or parent and child said this. So after the data is anonymized, we ask our clinical team to annotate it, just like they would in-person therapy sessions. And our clinicians are all licensed clinical workers. But Chloe, if you want to add anything to.
Sure. Hi, everyone. So I think that question came in before the Happy Pillar presentation. So I wonder if it was asked just more in general, for example, something that's more like a generative AI that's responding, or some of the examples that Alex gave, like with the virtual environment. Not that I know of is the short answer. I don't know about a model being asked the same questions. At the same time, as Maddie indicated with Happy Pillar, it's part of why it's so important to have a clinical advisory board like we do, and mental health professionals who are licensed being involved, so that there is that level of not just credibility, but also the ethics, the knowledge of evidence-based practices, and so on. So definitely a great question. It would be really interesting to see if some of the other models out there could find a way to get AI to take these tests. I'm sure it's possible in the future.
Cool. Thanks, Chloe. I think Glenn.
Yeah, Glenn, yeah, raise your hand. Yeah, Glenn.
Yeah, hi, good afternoon. Yeah, thank you both for the forum today. I really appreciate the depth of content and talking about Happy Pillar and other solutions. So a question for you, Maddie, around barriers to adoption. What have been some of the kind of obstacles you've had to work around, and particularly anything with regard to socioeconomic or other demographic groups that might, for whatever reason have, more of a resistance to behavioral health treatment and the technology?
Yeah, great question. I would say that the concept of using an app or using technology in general for mental health care or therapy in general is a new thing. But there have been studies done on the efficacy of something like PCIT being delivered in an app. So we typically point to studies like that, and we, for instance, make the onboarding for when you download the app as seamless and easy as possible. So it doesn't feel like a huge lift opening the app up and doing something like, playing with your kid for 5 minutes a day, seeing how you did, receiving feedback on that, and continuing to do that and see results. But I will say that parents are just so stressed, and I see that, my co-founder and CEO Sam's also on the call. I will say that, and she'll agree, parents are just so stressed that they're looking for anything, any kind of support that they can get. Therapists see that their wait lists continue to go up. And we have a lot of therapists recommend Happy Pillar to their patients that are on their wait list. We started running ads on problems like, my 2-year-old is hitting me, or they're tantruming. How do I get, I need some help with that. And so when we started running ads on the kinds of problems that parents were searching for, we saw our conversion rates really go up. So that points to this huge demand and urgency out there for a solution like this. And that makes it easier for people, using app or technology in general for mental health care.
Mm-hmm. I think that another question maybe is the standard way actually maybe I can give the answer by the standard way, because I look at the older how to make engagement with the patient and then feedback loop is a very, very theoretical, but I think that it's better the maybe talk about in reality, in practice, how you can provide this kind of how to make you more better engagement with your patient, particularly this the child, right? The children, because usually the adult engagement is a little bit easier than actually the children, right? So how you can actually practically done, and then how you can provide a feedback loop to you have some apply to the methodologies to your children, and then how you get the feedback and then the improvement again or something like that.
Yeah, I mean, I'll talk a little bit about how we collect feedback within the feedback loop as it relates to our machine learning models. Every time parents start recording within Happy Pillar, we record that interaction. After it gets anonymized, we provide feedback on it, and the feedback is essentially classifying what they've said into specific categories and then providing recommendations on how they did and how they can improve. We also continually look at our models to see how accurate they are, how well they're doing, and we take this production data, we continue to, weight tune, do, model hyperparameter tuning. Continually, we clean up our data, we annotate it with, the help of our clinical team. So those are all ways that we continue to make sure that our models, the fidelity of our models is high and stays true. And just like any other app, we have a parent advisory board that, thanks to our head of marketing, we're able to launch. We get feedback straight from our parents. It's really nice, and it's, kind of a privilege because users and parents are telling you exactly what they want, what they'd like to see in the app. And so we take their feedback very seriously, and we prioritize it, and we make sure those features are available within the app.
Mm-hmm. Another question is if you look at it at what kind of support or solution is available during the assessment. Pathology is starting to emerge. Assuming that this is because this is toward the children, right? Because we don't know about any kind of whether he's ADHD or autism, whatever, right? So how you can do?
Yeah, I mean, I'll take this, but again, Chloe, I think you're the best person to talk about this, if you want.
Sure, I can jump in. So because Happy Pillar is really geared toward parents of children 2 through 7, there are a lot of common diagnoses that it would just be too early, even if they went for a formal assessment with a psychologist to provide a diagnosis. I will say it's not necessarily geared toward children without any previous diagnoses. So if they are 6 or 7 years old and they do have an ADHD diagnosis, just for example, does not necessarily mean that Happy Pillar would be contraindicated. So Happy Pillar's platform, because it is modeled after evidence-based existing therapy modalities like PCIT, it can absolutely be used to address concerns like symptoms of ADHD, anxiety, depression, and so on. And of course, it is possible that these families are engaged in weekly therapy. Our app is meant to be used by folks that are on wait lists because they know their child needs both intensive support outside the home and supports like Happy Pillar. It can be used in conjunction with therapy to make their time more effective. and it can be used by parents that maybe aren't sure what they need, or they know that they need support and they're exploring ways to address their challenges. So really, Happy Pillar can be that solution for parents, or it can be a complement to other solutions like traditional weekly therapy. That being said, if this question sort of relates to more serious concerns, there are several points in the user journey in the app where, for example, if a parent indicates that there's a safety concern with their child, they're going to get a pop-up that says that they need to contact emergency services or that we are not appropriate. That being said, that is a similar pathway that would occur for a parent who brought their 5-year-old to their, traditional weekly therapy session. If that child is having a serious concern, that therapist in real time would then refer them to, emergency services, inpatient treatment, and so on. So that's just a challenge no matter what.
Okay, so another
Thanks,
question is,
I could not have said that any better, obviously. That was great. Thank you.
okay, thank you. Okay, so we still have about 4 minutes. I think that this is the point, very important point, because recently, for example, particularly in the digital therapeutic community, that they have a very, very concern about, you may have heard about recently, the high-profile failure of the DTX Pioneer. For example, the Actely actually will be acquired at a very low price to some other company. And after IPO, they cannot generate enough revenue. And also another case is like a better therapeutics. They're developing for what kind of the chronic disease, and they were in the FDA clearance, and then it have a financial problem. So delisted an IPO. And as you know about the peer therapeutics. So I found the several. And then they all starting from the prescription digital therapy, right? Because it's a very easy way actually to get the make money. Because unless you have the adoption from the doctors and adoption from the insurance company, actually you cannot generate. So and then the after recognize after IPO, then they have a difficulty to generate revenue through this kind of the prescription like a pathway. So they changed their business model for from the B2B to B2B2C or the B2C. So for example, Endeavor RX is like a for the targeting the children's in ADHD, and then they try to get the revenue, but had a difficult. So it's too late to pivot there. So I think that you are the best model that may be a good model, because you're starting from the initially to adopt from the users, like a parent, and then for example, parent is good payer because it's for their children, right? And then so there you have some adoption from the parent, and then they will be using for the children's mental health problem. So it is a good approach. And then usually the pitfall in the serious digital therapeutics is that they're too much concerned about pass through the FDA clearance and the clinical trial or something like that. But I found that you are the best model to actually you can test a real life test, right? Real life evidence, because you only have users. Yeah. So I think that there will be the good best practice model, because I'm going to have a webinar at the end of this year, at the end of this month, about how actually I analyze all this industry, and then I'm going to share my view that what is the best pathway for the digital therapeutics, and what's the best practical business model, how they can generate evidence, not just stuck into the FDA clearance, whatever, not in the market, but create evidence through the market, right? So through the revenue generation. So I think that you are the best model I can think of. What do you think about it? I'm just thinking about it because I've seen your model today. So
Thank you. Yeah, really appreciate that. Yeah, and we've been able to show, not just willingness to pay, but a lot of impact and outcome via marketing to parents, and we acquired a lot of those by word of mouth.
okay, so it's almost time. So a lot of people are just saying hello. So Okay, so thank you, Maddie. It was a fascinating presentation. And then I'll list you as the starter file list, and then because I'm going to provide all the information to other peers to know about your what you've done. And then I hope we'll see you in person in Boston in sometime.
Absolutely.
Yeah.
Yeah, we'll
And
see you in
then
Boston. Maybe you're
Yeah.
able to come down to New York.
yeah. Okay. And then so thank you for the attendance, because it's a fascinating time to share the idea. Then there was a fascinating question, and then very deeper level question that I haven't seen. Okay, so thank you for everyone, and then have a nice day. See you maybe in my next webinar. Okay, thank you. Bye
Thank you
bye.
so much, Alex. Thanks,
Yeah.
thanks, Chloe and everyone.
Yeah.